Like and subscribe right now, or else this will be in your bed tonight. r/AskReddit by Planet Reddit. Doctors of Reddit. What's the best asking for a friend story you've heard? One girl was interested in laxatives for a friend. She tried to learn everything about the dose, where what to buy, how to drink. She was brought in a week later with complete intestinal atony. She tried to lose weight so much and drank 2 or 3 tablets at a time. Oh, I have more stories like that, lol. Hope you got better. Wife's dad is a urologist. When we first started dating, a friend of mine wanted her to ask if any of the penis enlargement pills were legit and actually worked. She went with the asking for a friend approach and he immediately assumed she was talking about me. Thanks babe. So, do they? Asking for a friend. He said no, but I think your friend should try anyways. I asked my doctor about AA for a friend of mine. Really? Years later the doctor still asks me how I'm doing with my sobriety. I've stopped trying to convince him I really was asking for a friend. So, how are you doing? Staying clean and all? Edit. Row. My first silver and my most upvoted comment at the same time. Also, looking at the comment below, I have both username checks out and relevant username. I'm doing fine. Dr. I've cut over. I was asked the following. So if I swallow cum and flush it down with vodka, do I still get pregnant? She was in early 20s. She waited for her actual friend who broke her nose in a bar fight. So if I swallow cum and flush it down with vodka, do I still get pregnant? Actually, I'd say the odds are pretty good. I couldn't contain myself. I was just an intern and she sat in the waiting room, not a patient. So I asked, how much did you swallow? She said that he came twice. So I said that vodka saved her. Lady walks in and goes, so if you cheated and got pregnant, but then had sex with your husband, would the baby become his? It took everything in me not to laugh. Haha, I would have shit myself laughing. Go on, we are watching. A doc had a guy who just got out of jail a few days earlier came in with his GF who had signed in for an STD check. Walk in to meet them and he says casually, is it possible to get gonorrhea in your throat? At that moment I knew he had gonorrhea in his throat. So, how would my friend know if he had gonorrhea in his throat? Having a very kitten throat. Do you sleep with hot male patients? Asking for a friend. Kind of you to ask for friend, since you obviously aren't asking for yourself. If the answer is yes, do you sleep with ugly male patients? Edit grammar. Not a doctor but pharmacist. Someone called the pharmacy one day. A young guy. I picked up. Excuse me. How much does Viagra cost? Is there anything cheaper? I have someone that needs it. I explain everything and suddenly, will it work if I take it with alcohol? The guy began asking for someone else. At the end was for him and was asking just because he wanted his little one to work while drunk. So, does it work? Asking for a friend. It'll stay up but you probably won't be able to finish. Also, don't take things that duck with your circulation blood pressure on top of alcohol. There are easier ways to have a really dumb night out. Not a doctor but public health worker. Kinda NSFW. Had an older man come into our clinic asking for a specific type of STD check. Guy's ex-wife was going around telling rumors that he was having sex with his goats, so was wanting to know if there was a way we could do a STD test that could prove if he hadn't had sex with any goats. Through this whole conversation, he just abruptly asks, so if someone was having sex with a goat, what STDs could they get? That dude is totally ducking his goats. Edit. Typo. Oh. Doesn't sound like a rumor to me. Not mine but one of the older pharmacists I work with went out to help this 20-ish girl with some med questions. She then asked him about condoms and said, if you were to do me, what condom would you use? Yeah, he just walked away. All 12 of them, at the same time. What a king. My father is a doctor and he got a call once in the middle of the night from his call shared doctor's patient. The man asked what to do about a bump on his friend's arm that he scratched and something came out. He mentioned it was leaking a little oil now. It was as it. He scratched a pimple. Woke the whole family up at 3 AM because he had to page my dad over as it. How old was this man? 13. I briefly dated a doctor and she told me a few hilarious stories. If my friend masturbated with someone else's vibrator, will she get an STD? Can wearing a butt plug all day give you diarrhea? If you have an ulcer and swallow a guy's cum, can you get pregnant? 2 out of 3 of these seem like somewhat legitimate questions. Seem like valid questions. Not a doctor, but I was an intern. I was in the OPD and this man from a different province came in and told me his friend has injected petroleum jelly in their member years ago and that now it's getting painful. Why yay. He came back the next day and showed his lumpy member. Edit. For clarification, this is done to increase girth of the penis. This is a common thing apparently. Saw a patient who did the same. Had to have his penis reconstructed. He told everyone it was worth it. What does it take if? Not a doctor, but I used to work next to a pharmacy and my boss, a 55-year-old man, asked me to go buy him some condoms for his nephew. Edit. A pharmacy, not a pharmacy. My phone likes to double letters. Alcoholics Anonymous Pharmacy. Anti-F Pharmacy? Studies have been done about the effects of THC on glaucoma. When I worked for a glaucoma specialist, we had a hippie type person come in with their family member for a new patient eval and ask the doctor to sign paperwork okaying a medical marijuana script for the patient's glaucoma. Problem was the patient was totally fine. Didn't find any signs of the disease and his eye pressure was within normal limits. And the doctor did not appreciate having someone try to trick him. To piggyback off of this, and because I'm tired of the questions, marijuana only lowers your eye pressures for max 4 hours. To have sustained effects, you'd need to hit the blunt 6x a day and nearly 2,200 times a year. Take the damn eye drops. I know a lot of stoners that would take that as a challenge. Another family medicine doc called in a doc yesterday on the cell phone asking what to do when you get soap in your eyes. Choose wisely, folks. I mean, it says so on the bottle. In case of contact with eyes, rinse thoroughly and contact a medical professional. Better safe than sorry. I wonder how you'd grow up to become an adult without ever having gotten soap in your eyes as a kid. That shit happened every time I took a shower, and that damn shampoo bottle lied to me. It did hurt. Who you asking for? A friend. Hey, I'll be your friend. Join our community Discord, link in description. Doctors are all busy ATM. And I was sure the top comment was gonna start with not a doctor but. There is one dream where in my dream, I'm Spider-Man, but I'm losing my powers. I'm climbing a wall but I keep falling. In my dream. Actually, it's not even my dream. It's a friend of mine's dream. You know, I'm something of a doctor myself. That dude could have outed Peter right there. A+ first professionalism. Not a doctor, but I saw this dude say to a doctor, can 2 white people have a black child? Asking for a friend. The man's wife had an affair. Edit. The dude had the baby in the stroller and when he was walking out he looked like he was going to yeet the child and I was secretly dying inside. That's rough. He must have had so many emotions running through his head. I wonder if the guy ever suspected anything before his wife gave birth. Wonder why she's always watching Madea movies. Yes, hi, this is Dr. X. I need to call in a prescription for hydroxychloroquine. Do you have any in stock? Asking for a friend. I have lupus, and while I no longer take Plaquenil for a couple reasons, reading about how doctors are writing themselves and their families' prescriptions makes my blood boil. There are a lot of people who legitimately need it for autoimmune issues and they can't get it right now. We're already at higher risk for COVID, now we have to try not to catch anything while flaring? Ditto, but I don't take it currently because of the side effects. These people taking it thinking it's going to prevent COVID are in for a nasty surprise. One of my besties called me late at night after his day party. He said someone who was staying the night wanted to have sex with his GF. They were drunk and a little uncoordinated, and somehow the frenulum, the little string thingy at the tip of the penis, ripped, and it won't stop bleeding. I gave his friend some general advice on stopping the bleeding and recommended a trip to the ER. The next day he asked me if I had any recommendations for urologists for his friend, because he needs minor surgery on his PP. I told him to cut the bullshit, and in response he sent me a pic of his injured penis. So, long story short, his wank got a remodeling and he is still with this vagina dentitus sporting woman. Divorced women cougars like to explain muscle strains as sex injuries to get a rise out of docs. Best way to deal is to stay monotone and not react. Patient describes proximal adductor muscle pain in hip flexion during recreational activity. Rated 7/10. Pain is now present during ambulation. If you don't react, they move along. Doesn't take long in the office to have seen and or heard everything. I'm not interested that you are recently divorced, started working out, and discovered Tinder. Good on you. But it takes more to get a rise out of me. One colleague in training had a professional cuddler with a similar injury. Doc was very conservative, possibly on the sheltered side, and in front of two of his superiors during the case. And she was not shy. I would add she was not visually what I assume most would hope for in a professional cuddler either. That one I enjoyed, on account of him, not her. Takes more to get a rise out of me. So, what does it take, doc? Fair question. I have had a few women want to show the way they take off their sports bra because it causes shoulder pain. Of course I couldn't let them expose themselves because that could cause me some work related grief that I am not willing to invite. But on a serious note, if you think about pulling off a wet, sweaty sports bra after a fitness class, the motion is similar enough to a shoulder impingement test. Fortunately, seeing cougar tits isn't the positive for the test, so you can skip that part. I have joked and considered using sports bra sign as an orthopedic sign, but I'd rather spend time on Reddit than trying to publish case studies. As for getting a rise out of me, stroke signs in a patient walking in the door with neck pain would be one. Or a patient with foot pain who isn't managing their diabetes because they don't want to accept their diagnosis, therefore causing nerve damage. Patients with cauda equina, numb crotch saddle region, usually after car accident, that don't want to take the next step, referral, which risks making nerve damage permanent, melanoma and other possible skin cancers. Stuff like that gets my attention. I'm aware no one wants to go in for a torn rotator cuff and come out with a referral for a basal cell carcinoma, but that's the job. So unless them boobs have a lesion that needs to be checked, I'd rather avoid the paperwork. HR is to be avoided at all costs. Asymmetrical shape, border not clearly defined, color not consistent, or multicolored, diameter over 6mm evolving or changing. If you see something questionable, get it checked. I'm a veterinarian. When taking a dog temperature rectally, an owner going mummy doesn't like it either. 2. I'm so glad my dog is the opposite. Took her in once because she was yelping and limping randomly, and I thought it was because she pulled a muscle, possibly related to a little arthritis she has in her knee. It was heart-wrenching to see her avoid greeting us because she was in pain. She's also a retired pharmaceutical research beagle, and as the veterinarian took her leg through the motions, trying to see if anything was causing her pain, she said I don't know if she would complain if any of this did hurt her. She's so well behaved on the table. She let us do anything to her. Yes, she absolutely would. Except for nail trims, blood draws, urinary draws. Thermometers are all fine, but don't touch her paws. We had been using Valium for nail trims, but based on her history as a working dog who still responds to handling as a cue to stay perfectly still, we decided to start using a Thunder shirt. She seems to be doing just as well in a Thunder shirt as with Valium now. Double points if it's the male owner who says that, and the wife girlfriend in question is right there beside him making a face that tells you he's in the shit as soon as they get back out to the car. Not a doctor. Heard this one from my cousin. A guy comes in and asks if it's possible to get a girl pregnant with someone else's sperm if guy A had sex with guy B before banging C female. Wish I knew the full story. Can't be sure, but my guess is that guy A had sex with guy B before banging C female. Yep, but in what configuration could there be leftover sperm on the guy's dong? If there was and it was a short enough time frame, like, maybe 1 hour, it's marginally possible, right? Like, maybe 5% chance the girl gets pregnant if they're BC if iffy that one time, and like 0.1% chance that the other guy's sperm outcompetes the guy having sex? Or is it not possible at all? Not a doctor, but was mistaken for one by a drunk dude at a costume party once. Okay, twice. Sent him to sober up the first time. Comes back 5 minutes later with no recollection of our first conversation and asks me for painkillers. And at which dose they kill you. I gave him the number for the suicide prevention hotline on a napkin and told him that they can help with the issue. He happily staggered away and I haven't heard from him since. Either he got help or he didn't, but either way, it was a weird experience. General practitioner here. One of my non-medical friends asks me that his friend wants to know a good home remedy for an STD. I told him a tablespoon of powdered detergent mixed in 1 glass of water should work. Next thing I know he's in my kitchen stirring a glass. What exactly is this remedy good for? Asking for a friend. Getting the stains out of your underwear. So not me, but a person I saw. So the patient, sick as heck, staggers to the doctor and at the absolute loudest possible voice she said, "Are you single?" Betty wants to know. Betty was her childhood pet cow. The doctor calmly says, "I'm sorry, but I am not interested." We were all busting out laughing and I barely could breathe. I later asked the doctor how he kept a straight face. He said, "Laughing on the inside. It's a lot like crying on the inside." That is now the hospital I frequently visit. Not a doctor. Fremulin. Get out of my head. When the patient woke up, his skeleton was missing, and the doctor was never heard from again. Anyway, that's how I lost my medical license. Archimedes. No, IT is filthy in there. I'm directly related to a nurse. More than once I've approached her with a question for a friend that actually was for a friend. Middle-aged women ordering a shitload of comfort food at our KFC drive-thru and then adding, sometimes multiple times, that it's not just for her. It's usually the contrary that happens to me when I get food delivered and discover that they put cutlery for 2 in the bag. Nope, nope, nope. Everything's just for me. Asking for my puppy. I took a class in medical parasitology. The professor, a PhD in parasitology, once had a very concerned neighbor bring him dog poop that had human pinworms in it. He suggested the neighbor take his puppy to the veterinarian for some albendazole and assured him that the infection would resolve. Pinworms are still a common and very treatable infection, even among first world children, but not puppies. Thanks for watching. Subscribe for 3 videos a day.